So here at EHA2024, having the pleasure to present some data on some subgroup analysis of the MAJESTIC-1 trial. So just to refresh our memory, MAJESTIC-1 was a single-arm dose-finding study for teclistamab, which is really the study that provide evidence that led to the approval of teclistamab in the US and other jurisdictions. And of course, there's some interest in seeing how that therapy performs in different subgroup of patients, particularly patients with features that we all understand are high risk of disease, cytogenetic high risk, extramedullary disease, high beta-2 microglobulins, and so forth. And the good news is, overall, this treatment performs well. The response rate for the overall study is close to 65%. And that is maintained in several important subgroup of patients. For example, patients with high cytogenetic risk, and patients with a relatively high proportion of plasma cells in the bone marrow. We're starting to see less of response on patients with revised, the ISS3, so those patients with very high beta-2 microglobulin, and particularly on those patients with extramedullary disease, where the response is about half of what we would see on patients without extramedullary disease, which are pockets of myeloma in places other than the bone marrow, for example, in the lymph nodes or in the liver and some other places. So I think it is give us some guidance as we counsel patients on the best choice of the therapy that's right for them. Give us some reassurance for some of those subsets where we know this drug performs well, and show us the opportunity for improvement. Perhaps with combinations with an immunomodulatory agent, perhaps with a cell mod, or perhaps even with another bispecific that we saw recently on the redirect trial, where a very high rate of response was achieved with extramedullary disease when you combine teclistamab and talquetamab, for example.